Hi, my name's Brittany and my partner's name is Latavia, and we decided to choose video number 2 for our discussion. So starting off with number 1, explain the errors noted throughout the video. So the first was that the person who took out the medications from like the Omnicell was not the same person who administered the medications. So obviously you're not supposed to do that. And whoever administered the medication obviously didn't do 3 checks. The patient did not identify himself by full name or date of birth, and the nurse did not check the wristband, so to compare like the full name, date of birth, and MRN, or allergies. She also didn't check for that, the allergies. Transferring nurse did not mention labs or the kind of medication the patient was on. Oncoming nurse did not double check and just went off of what the previous nurse told her. She didn't double check information before administering medication. The nurse did not check labs or do any necessary assessments before administration. If she would have checked her lab, she would have seen that the INR was too high, and you don't administer an anticoagulant because there's a risk for like hemorrhaging or bleeding. Obviously, since it wasn't in a therapeutic range. And then you also shouldn't have any interruptions while you are administering medication, such as a phone call. You just let it go through to the charge nurse to save yourself from any error. Number 2, indicate how utilizing the 6 rights for medication administration could have created a positive outcome. So if she would have just checked the right patient with at least 2 identifiers, she would have been fine, which she didn't really do. So you should be checking it, the wristband with what's on the chart for their full name, medical record number, and date of birth. Right dose, the nurse determines whether the drug is safe to administer according to the drug's pharmacodynamics and the patient's vital signs to see if it's the right dose for the specific patient, and if it's good to be administered within if the labs or if the labs were within normal range. Utilizing the 6 rights would have ensured the patient's safety, such as checking the 3 checks, the medication and the right patient, 6 rights 3 times. They probably would have told the doctor to hold the medication, and that would have eliminated this error. How does medication errors impact the nurse, client/family, and the organization? So medication errors impact the nurse by obviously professional repercussions and psychological difficulties, such as dealing with guilt or worry that you may have harmed someone. The client and family, obviously, not just physical but psychological pain, such as distrust within the healthcare system. It could honestly also it could be a financial burden, because God forbid like something happens to the patient and they may have to be there longer, can cause death, and to the organizations it can cause also financial issues and legal issues, reputation. It can affect the hospital or the organization's reputation. And number 4, have you or a family member ever experienced a medical record or medical error? Yes. So my sister has a common name. Her name is Sabrina, and our last name is also very common. It's Rodriguez. There was another Sabrina Rodriguez on the floor, spelled the same, at the same time she was there. And when the nurse went to go administer her medication, she was going to administer the other Sabrina Rodriguez's meds to my sister, because right when she was supposed to scan, that's when the computer told her that there was an error because she hadn't done her third check to make sure at bedside to make sure that it was the right patient. So luckily nothing happened. But yeah, so it's always important. It's a good reminder to make sure you do your 3 checks. And yeah.